Okay.
Wait.
Just a second. Por ahí tenemos.
Give me the sign.
Yeah.
All YouTube.
Okay. All right. Good morning, everyone. Thank you very much for taking part on day 2 of this MEDICI conference, Digital Inclusion for All. Today, this morning's session, the focus will be on diversity and community. So we have two very good fellows from the MEDICI project, Anna Cimbukli and Stefania Aceto, who will be presenting our latest developments around the project on the aspects of developing the knowledge community. So I'll give the floor to Anna and present our work on knowledge community building.
Just before, I would like to mention a couple of technical issues, aspects of this meeting. So just to inform you that this meeting is being recorded and streamed live on YouTube. And at the moment, the flow of the meeting will be as follows. So we're going to have a keynote at the for 20-25 minutes. And after 25 minutes, we will break to the different 2 rooms. So please, for those who has registered as all-in ticket, you haven't chosen which session would you like to go. So if you could right now, next to your name, if you look at the 3 dots next to your screen, and you can there rename yourself and put whether you would like to be number 1 or number 2. So number 1 will be case studies and good practices for the target group, such as unemployed, migrants, minorities, and youth. And number 2, older people and disabled. So again, number 1, unemployed, minorities and youth. Number 2, older and disabled people. I think that there will be already in the chat. You've got the text. So I would really ask you to do it so that it's easier for us to allocate you after the 20 minutes. After the keynote, there will be a 5 minutes break, rightly for this logistics, but also a comfort break that you can take, and then we're gonna meet all in 2 different breakout rooms. Thank you.
Thank you, Marta. This has been very useful, very practical. So we need to follow those steps if we want to stay in this discussion. So let's move on to Anna Cimbukli, who will be presenting her work on the groups and around the knowledge community building.
Thank you, Remus, and thank you, Marta, for this opportunity to present today the MEDICI knowledge community. We all have a great opportunity to be here today and discuss over the internet about our thoughts and ideas and worries. But the fact is that MEDICI is actually focusing on the socially excluded groups, the groups that are less likely within the communities to be able to access internet devices and be able to communicate at this time, especially of COVID-19, that we all had to work remotely and study remotely. So the main reason we developed this program was to identify what are the gaps in the digital inclusion of the socially excluded groups. And we all know that, and probably if you've been here yesterday, you've heard that digital inclusion goes hand in hand with social exclusion and poverty. We grossly identified 5 groups, which we're going very briefly to talk about. But in fact, we have to be very careful because within each group, we have several subcategories. So the groups we identified are, first of all, people over 55, because naturally this is the population that is less exposed to the digital world and is quite difficult in an older age to get familiar with the digital demands. But within that population, we have to take into consideration that there are many subcategories, which, of course, in the first pilot phase of MEDICI, we were not able to identify all of them. So it's quite different if you are over 55 and you are still in employment, and it's quite different if you are already unemployed or if you are already at risk of unemployment. And of course, hand in hand goes together with the health issues that you start developing and experiences after a certain age group. Then we identified people with disabilities, but again, the question is what type of disability, because it's different if you have a hearing impairment or if you have a vision impairment or other types of disabilities. Then we talked about children and young people who face social problems. Again, it's quite different to be at home, even though you might be living in a family that is rather poor and cannot have access to internet and other devices. And it's quite different if you are already homeless, if you are a refugee child or a migrant, or if you are already a school dropout, or if you are a child who is growing up in a correctional institution or in another setting where access to internet is not probably allowed. Then another category is the unemployed. Again, in the unemployed, we need to separate between the long-term unemployment, and we have to take into consideration gender issues and the educational level. And the field of work is quite different to be unemployed if you are already a bachelor's degree graduate. It's quite different if you are unemployed, but you hardly have finished the primary or secondary level of education. And then, of course, in the category of migrants, it becomes, again, very complicated because you have the legal migrants, you have the illegal, asylum seekers, refugees, and women that often suffer being in a less equal position within their own group and within society. Therefore, heterogeneity is very, very important when we're talking about the different groups. We cannot identify each group as being as being unified and as covering all categories and all aspects. The second issue we need to take into consideration are the multiple identities. So you have to, the human being is a whole, it's different compartments. So it's quite different if you are a woman, at the same time an asylum seeker with low educational level, unemployed and probably homeless or living in a camp, and maybe a mother of 2, 3, or 5 children, and it's quite different if you are already a man who is a legal immigrant working in an environment. Okay, so the multiple identities are extremely important for identifying the digital gaps. And because of all that, we now have more or less the theory that some people experience not just dual exclusion, because they belong to a socially vulnerable group, but maybe even triple exclusion. Of course, there are some models that they try to suggest that the faster and the more accessible internet becomes to people, it is very likely that this gap will actually close. But again, we have the dystopia model that actually argues that, and this is in the basis of our theory, where MEDICI knowledge community was built, that unless we fully comprehend the situations which people experience, it will be quite difficult to close this digital divide. Now, I don't want to go into much details and give you more data, because I think if you followed yesterday's sessions, you already have all these ideas and you know this data. But it's quite interesting that, as we heard yesterday, 9 million people in the UK, for instance, alone, cannot use a device on their own. We know that there are perhaps several places of employment that can be filled, but most of the possible employees do not have the digital skills to fill these places. We know that a large part of the EU population lacks basic digital skills, and by basic digital skills, we simply mean even to be able to access an email address, to use your mobile phone for accessing some services that the governments now give through the internet. And that there is, of course, a gender imbalance issue, because even in the ICT specialists, only 1 in 6 is a woman. We have also some data, according to DESI, that 80 million Europeans do not have access to internet today. They either don't have a computer, or the computer is, the access to internet is very expensive, or they don't have the skills, they find it very difficult to connect digitally. Sometimes they don't find it relevant to their lives to connect, and we'll discuss a little bit about it later. And they don't find it relevant maybe for the type of job they do, or about their personal and family life. They don't have the education to do that, or they lack the motivation. We've heard yesterday, for instance, from one of the speakers, that sometimes people have to choose between buying food and connecting to internet. And of course, we understand the priority would be to buy food. Then there are some studies also in the United States that demonstrate that there is even a racial difference in relation to the internet use. And this corresponds very much to the symptom of digital divide. Especially the racial difference, of course, is always connected with poverty and with the low income families have. And this limited availability, of course, is related to the limited opportunity to develop your skills, your literacy, and therefore to improve basically your living conditions by access better jobs and better education. Therefore, it seems that being non-white is very much related to the digital divide, at least according to what the US studies suggest. And there is also some evidence that if you have an income that is less than 20,000 euro, it's more likely not to be able to access the digital devices and use it for your own development and professional growth. So more or less, these inequalities are now universal. We see them from the data we have in UK and in USA, but we also see them in other parts of the world. And it's very much linked with health inequalities, given the fact that now to access health services, you need to be able to use the internet. Therefore, we more or less all made a false assumption that people can actually use the digital devices. They will very easily and very fast adjust to the new reality. It is something that we did. We had the benefit of doing that, but not everybody can do that. And sometimes the motivation is lacking because some people don't see, as we said, the benefit for their own work, especially with socially vulnerable groups. So we need to work, first of all, with the organizations that work directly with the socially vulnerable groups, and we need to work with the people, with the staff that serve the socially vulnerable groups to be able to access these populations. Because if we leave it at the top level, we're never going to be able to reach people on the ground. And we need to think of the digital inclusion in the same water we think now about electricity, about water. We need to think it as a human right. Otherwise, there are going to be many children left out of school and many people left out of school. I'm going to stop here, and I will call my colleague Stefania Tsetou to discuss a little bit more on the basis of that ground, how we developed the Digital Inclusion Atlas and Knowledge Community. Thank you.
Thank you very much, Anna. So yes, in reply to what you just said, so the need to push for more effective bottom-up initiatives and support the organizations that are working day by day with socially vulnerable categories, and at the same time to support policy and decision makers launching their intervention on digital inclusion and made these more responsive to the needs of the ground. It is exactly with this in mind that we built the Digital Inclusion Atlas and Knowledge Community. This is a virtual space where you can find an online catalog and map of good practices in digital inclusion, addressing the socially vulnerable categories that Anna just described. And it is also a space for collaboration, collaborative learning and knowledge exchange among stakeholders involved in digital inclusion. By stakeholders here we mean both the organization working day by day on digital inclusion and policy and decision makers, and of course the researchers. So it is a community that gathers people that are committed to improve the situation of vulnerable groups, improve their social and economic status, also by means of enhancing their digital inclusion, as was discussed yesterday in the keynote. The reason at the root of this deciding to provide this tool is that when we started the MEDICI project, we found that quite a defragmented picture in terms of interventions in digital inclusion, both across EU member states and within EU member states, so across the different regions of the same state. Limited opportunities for collaboration among digital inclusion stakeholders, and very limited culture of evaluation among the people working for digital inclusion, meaning that interventions were very often evaluated only at the end and without having sound evaluation approach since the beginning, with a theory of change in mind, knowing since the beginning what the impact would be, not only in terms of achievement of the indicators that were related to that specific project, but also in terms of socioeconomic impact that this action or intervention would have on the target group. So I don't know why I cannot go on. Okay. Oops, sorry. I need to go back. Okay, so this is a screenshot of the Digital Inclusion Atlas that you can find at digitalinclusion.eu. I don't think we will have time to show it afterwards, but if so, I will try to do so. We have gathered so far 268 good practices. We started actually with 800 good practices. that were collected by our staff. And then we had a sort of filtering process of all these interventions to identify the good practices that could feed to a set of criteria we had identified, and that could feed 3 clusters that we identify, cluster A, B, and C, that you can find summarized here, where cluster A are the majority of initiatives that we found, and are initiatives that are quite young. They have not ended yet. So they don't have yet an evaluation, but they were designed with care, and they are very likely to have an impact. Then we have effective initiative, cluster B. These are initiatives that ended already. They have been evaluated positively in terms of impact of the target group. And finally, we have cluster C initiative. These are replicable initiatives, meaning initiatives that whose impact has already been proven by more than one evaluation exercise carried out, and which have been replicated already in other contexts in terms of addressing different target groups or different geographical areas. These initiatives are presented in a map that is interactive, so you can search by target group, by cluster, or by country, and you can then get a short description of each case, and also a long, let's say a very throughout description of the case. Practices have been identified, as I said, mainly by the MEDICI team in the beginning, but then we gave this possibility also to the members of the digital inclusion community. This is available again at digitalinclusion.eu. Registration is free, and the members of the community can access the knowledge map and catalog. Of course, we have 260 registered members to date. And it's a community that was built, as I said before, to enhance interaction and knowledge exchange and learning among members. So what we have there, we have a space for interaction that is the forum and the digital inclusion story space. It's a space where community members can upload their projects and candidate them to be part of the MEDICI catalog. So far, in the last 3 months, we had more than 30 cases submitted by the knowledge community members. And out of these, about 1/3 managed to get to the catalog. We have, as I said, a learning opportunity that is provided by our learning events. We organized so far 13 online webinars with more than 500 participants on different themes related to digital inclusion, ranging from applying the theory of change to discussing the situation of digital inclusion, for instance, for the homeless. We have learning resources that are podcasts and evidence digest, where you can find a short analysis of the situation of the different target groups as emerging from the analysis of practices we have collected. And of course, we have learning resources on evaluation with tools that people can use to improve, let's say, the effectiveness of their projects and interventions. So this is what we have come up until now. The idea is to keep this knowledge community alive, because our dream, let's say, is that the community keeps on enriching the catalog with new interventions and new cases that can be inspirational for other stakeholders, and that this knowledge exchange can enhance collaborative learning among the members of the community. So this is about everything. I think I'm okay with the timing. If there are some questions, otherwise I can show a bit more the community.
Thank you, Steffi. Thank you, Anna, for this very concise presentation and overview of the MEDICI developments around building a knowledge community. Indeed, I think what we can actually hold today is basically the multiple implications of the vulnerability on one's, participation in a society, in a civic society, and of course, what we in turn have done in relation to bringing, bridging, making contacts, bridging communities together, or making new communities and associations and partnerships together. Thank you very much, both. I think we can stop sharing this and let's have a look if there are any questions on chat. I don't know if there are any questions about this. I know time is quite limited. If not, I think perhaps Marta would like to take the floor and just remind you the, so the practicalities as we move forward, and perhaps we have the space and the floor to discuss more across the 2 breakout rooms that will follow next.
Yes, thank you, Ramos. If there are no questions at the moment to our 2 colleagues, please, we're going to have at the moment around 8 minutes break. And please, once more, next to your name, if you can indicate whether you would like to join breakout session number 1 or number 2. In the chat above, if you scroll a little bit above, you will have, so breakout session 1 is challenges in digital inclusion among youth and unemployed and migrants. And breakout session 2 is about older people and people with disabilities. So you're gonna, and we are going to present good practices that are actually included in our catalog there. So please change your name. You can do it on the right-hand side. There are 3 dots next to your profile picture, and then you just put rename, and just simply by adding number 1 or number 2 to your name, it will make easier for us to allocate you to the right room. So thank you for now, and we will take a 5 minutes break while allocating you to the rooms, and see you all in the breakout rooms, and we start from there. It's going to be a 1-hour session in each breakout room with last 5 to 7 minutes questions and answer session. Thank you very much, and see you in 5 minutes. And please don't disconnect.
There are some questions that we didn't answer, in fact, but I think we don't have now the time for that.
If you wish, Anna, you can even answer right now while we are allocating, and somebody who will listen will listen. Not.
Okay, for instance, one question is about whether we believe that the digital divide will actually be deeper because of the social exclusion. Perhaps it's too early to say, but if we keep going as we do right now, I think it is going to actually deepen. We have some experiences from schools that not everybody had the opportunity to attend schooling, and not enough is done yet so that every child can have at least a computer at home and access these devices. So I'm not sure if you can be optimistic, or if you need to continue arguing for access for everybody. And then we, of course, haven't given enough training to people that work directly with the socially excluded groups, and a lot of work needs to be done there to ensure that the digital divide will somehow close. And there is a discussion about the continuation of MEDICI. This is something we need to see, I think, in the upcoming months. Thank you.
Thank you, Anna.
Please write in the chat or rename yourself to know what room you want to attend. Otherwise, we cannot allocate you. Thank you. We need this information for Anna Kay, Carla Montanini, Dai Griffiths, Eba Oceanilson, Edith, Elona Shehu, Evantia Batala, Federico Monaco, Franz Santi, Johanna Gerguli, Iskanias, Mara Capilupi, Pina Sodano, Regina Hong, Tania Campanella, Brucetis. I'm sorry for the pronunciation. Thank you.